Welcome back. It's time for Healthy Matters. Well, June is National Men's Health Month, a time to remind men of taking charge of their health, and men are significantly less likely than women to see a doctor or report their symptoms. And prostate cancer is the second most common cancer among men in the U.S. So Dr. Brian Langford with UAMS joins us today. How are you doing?
I'm great. Thanks for having me.
Of course. Thanks for being here. This is such a big deal. Men sometimes don't take their health as serious. So for you, why is it important that you guys bring awareness to this?
You know, I think that I'm a kind of a prototypical guy patient. You know, I actually have my first PCP appointment tomorrow that I've had since I've seen my pediatrician maybe 20, 25 years ago. So I think a lot of times we're stubborn. We think that we're healthier than we really are, and we wait until a problem gets pretty significant or serious before we seek care. So, you know, men's health is more about raising awareness for overall men's health. You know, really encouraging men to see their doctors so that they can have early detection of different issues that affect them, maybe even treatment or prevention of these same issues sooner rather than later.
And one thing that many men may encounter in their life is prostate cancer, even if it's not them, maybe a family member or friend. So what causes that?
You know, prostate cancer, there's a lot of different things that can go into that. There's a genetic component. So if you have a family member, a father or a brother who has prostate cancer, that puts you at a higher risk, and you probably need to be evaluated sooner rather than later. But, you know, there are different things that can lead to it. Overall, though, to prevent prostate cancer, we just recommend a good, healthy lifestyle. So anything that's good for the heart is probably good for the prostate, especially if at some point you're going to need a procedure or need some sort of treatment for prostate cancer. Then having that healthy lead up to that is going to be beneficial for your recovery.
When should they first start going in for those exams?
So in general, we recommend men starting to get screened around the age of 55. And that goes until about 69. And so usually that just means some blood work every couple of years, and just to keep an eye on things. And then that can be escalated based on what that is. But you know, you can always get your primary care provider, ask your urologist when screening may be appropriate for you. Because like I said, if you do have a family history or something else like that, then you might want to start screening earlier. And
some people have more risk than others, right?
Correct. Yes. Family history and that genetic component has a very strong factor. Also, you know, higher fat diets, obesity, smoking, all of those things have a role in cancer development.
Interesting. And they say that black men are 60% more likely to develop prostate cancer. Is there a reason why?
You know, I think a lot of this is just access to health care. You know, I think that, you know, different socioeconomic statuses have a factor in how soon men are willing to go see their PCP or even have just routine checkups. So I think that getting initiated into that screening process early and often is important. So it's more the earlier detection of that prostate cancer can be beneficial.
And now, how can men lower that risk? So we know that maybe they should be going to their doctor more, staying healthy. Right, yeah. Is there any way you can lower your chances besides
really.
Those two things?
One in 3 men will develop prostate cancer, and you know, like I said, there's the family component to it. So definitely start that screening process earlier if you feel like you need to. But I'm always here to counsel patients on when that might be appropriate.
Very nice. And so it is Global Men's Health Month. So are there any other things that you think men at home should know, or family members that want to encourage them to take their health more serious?
Absolutely. You know, go see the doctor. You know, for me as a urologist, I think a lot of times I'm seeing these guys for the first time. They haven't seen a provider in several years, and they have an issue like erectile dysfunction. And they'll come in and talk to me, and you know, some of the more common reasons for erectile dysfunction can be heart disease, diabetes, maybe a medication side effect, depression. And so you have all these other factors that are men's health issues that maybe they don't talk about, maybe they're not being, you know, evaluated for by a primary care doctor. And so I'm really the first provider that's really screening these patients for these different, you know, health issues. And so I can get them to the correct person to get those further treated.
Thank you for being here today, and I'm definitely going to be telling my family members, my dad, my brother, and hopefully people can tune in and see this as well.
Please do.
Thank you again.